Hello everyone. Today we have Dr. Satyamvada Pandey with us. She works as a senior consultant in Eternal Hospital, Sanganer, and we would be talking about gynecology in teenagers with her today.
Hello ma'am, I'm Priyani, this is Pavi. We wanted to talk about the common issues you see in teenagers these days.
In your field, what do you think?
Yeah.
Hello, I'm an obstetrician and gynecologist, and we've been seeing teenagers coming to us, but of late they have started coming to us frequently. So there are some issues which I really very frequently see in my OPD clinic, which I want to talk about. So the most important thing now is adolescent obesity and PCOS, which we usually hear as PCOS, PCOD, there's so many names. So that is one thing which is really on the rise. The reason being is our lifestyle. So we have gone inside a very sedentary lifestyle. Our physical activities have been reducing also after COVID, and at present because of the weather, maybe it's really hot, and also we have been more into the social media on the net, limited writing, limited exercises. So that is why adolescent obesity is on the rise. Second thing is which I very frequently want to talk about, and it's a topic which has been not been discussed well, is genitourinary health. Like frequently now girls are coming to me with vaginal discharges, itching over private parts, ulcerations, and that is the reason they really frequently visit us. And the third thing is sexual health. And awareness about sexual health is very important because the age of sexual activity is decreasing in our country also. So these are usually the three things which I talk about in all my discussions with you girls.
So, ma'am, you talked about how people are not generally aware about vaginal health. So, do you have any tips as to how we can change our lifestyle as teenagers and how we can prevent these issues?
See, vaginal health is interrelated to sexual health. So one should know that there is no sex called safe sex. So any sexual activity gives invitation to any number of infections. Some can be sexually transmitted diseases, some can be just some vaginal infections. The most common vaginal infection which we come across is vaginal candidiasis, that is a fungal infection. Other bacterial infections like bacterial vaginosis, trichomoniasis, which we name them as such. And otherwise, there can be some other infections which are really fatal and can stay lifelong. To name a few, it can be hepatitis B, it can be HIV, which later turns to AIDS, it can be syphilis, it can be so many other things. So, the first thing is sexual activity should start at an appropriate age. It should always be 100% protective. That means you always have to use a barrier condom, and your partner should be a sole partner. That means you should not keep changing your partners. Also, perineal hygiene is very important. Frequent uses of frequent change of sanitary napkins while you are in your periods. Take care of the washrooms where you use, and appropriate and timely visit to a gynecologist if you feel that you have some doubt about anything. And a visit to a gynecologist need not be for any infection. It can be just for any query where you have some confusion and you want to get the right opinion.
Ma'am, hygiene is a major part in preventing such diseases. I think we all know that hygiene is important, but how do we maintain hygiene?
See, if we see the numbers, almost 80 to 85% females will have an episode of vaginal infection in their lifetime. That does not mean that they are not hygienic, they do not maintain their hygiene. So, because the female private parts is in such a place that it is usually moist, it is humid, so these are prone for infections. And the second thing is, which is very rampant nowadays, are vaginal washes. So vaginal wash is no certificate of perineal hygiene. So the first important thing is keep a track of your cycles and change your sanitary napkins frequently. If you feel that you are allergic to them, you can shift to other means. That can be cotton pads, that can be tampons. They can also try a menstrual cup. after consultation with the doctor. There are some medications which we say as it is over-the-counter medication, OTC. These are very simple antifungal creams which maybe when you go to your doctor for the first time and she gives you treatment, you can ask her if you can start applying when you find the earliest sign that you are having some vaginal infection. That can be used. Third thing is avoid vaginal douching. That means cleaning your vagina with anything, any washes, anything is not required because the vaginal pH, the usual bacteria which is there, it's called the lactobacilli. It causes the vaginal pH to be acidic. So if you frequently keep washing it, then it becomes basic, it becomes less acidic and invites the normal bacteria which is present in the surrounding areas. Fourth thing is, whenever you wash after you've passed motion, it should always be from front to back. You should never touch your private parts after you have washed your after passing motion. It's a very common source of E. coli infection and a very common source of UTI also in females.
So you also talked about PCOS. So we have heard these terms everywhere, but somehow as teenagers we don't really know what they mean, what actually they are.
See, PCOS, PCOD, these are the same terms, and if you can label them, it's like polycystic ovarian syndrome or polycystic ovarian disease. So a syndrome or disease means there are 2-3 things in them. So if I enumerate them, first thing is, sign or suspicion that you might be a PCOS patient is when you start having delayed cycles, like you start getting in 12 months, 2.5, 3 months, or you don't get it all in 6 months maybe. And but this pattern can be very regular in the first year when you start getting your periods, like you start getting your period at age of 14. For the first year, 15 and a half years, you can have such cycles. You can have once in maybe 3 months, 4 months. That is absolutely normal because at that time the HPO axis, the hypothalamo-pituitary axis, matures. So in that time you can have irregular cycles, but later it should settle down. Settle down means you can have a cycle interval of 24 to 38 days. So if I broadly say the once in 45 days a period is absolutely okay if you're having that pattern since long. But if you feel there's a drastic change in your pattern, like earlier you were having 30 days, now started 45 days, maybe you should see for signs of weight gain. If you have started gaining weight, you have started noticing some acne in your face which were not there earlier, some hair fall, excessive facial hair, that are signs of hyperandrogenism. That is, male hormones is in excess. That is the second thing we notice. And third thing which we evaluate is an ultrasound, which tells you that there are many small follicles in the ovary which do not grow to a proper size which can ovulate. So the main problem is anovulation. That is what we try to diagnose and treat.
Also, ma'am, you talked about pads and menstrual cups and all. I feel like our generation is too used to using pads, and now we are switching to menstrual cups and tampons. So, do you think there's some implications of switching to this?
Also, when talking about this, there's a general taboo surrounding these situations that people don't really talk about all of this at home or between their friends. So, what do you have to say about that?
See, for anything, for any small or big issue or confusion which comes in our mind, so we try to speak to our friends first and then later to our mothers. But I feel that if you feel that you are not getting the right opinion or there is still some confusion, it is better to go to an expert. So earlier we were switching to sanitary pads because they were convenient, they were comfortable. But we have seen that so many patients have started coming to us with allergic reaction, with rashes. So now we advise that they can use a tampon, and a menstrual cup is even better than a tampon because a tampon can be left inside if neglected, can be a source of infection. A menstrual cup, if chosen of the appropriate size and started under the direction of a doctor, is really good, and it does not harm because it is eco-friendly also. You are not disposing it and you're not buying it every time, so you're reducing the plastic waste, and it can be washed and sterilized as any other plastic, like maybe your plastic bottles, feeding bottles, your nipples that you give it to your kids. So it's that almost the same thing.
It's very reusable. That's what it is. Okay.
So that's it for conversation today. Thank you, ma'am. Hope our audience learned something new and understood. With that spirit, goodbye.